Hi, everyone. I'm Dr. Faisel Syed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege. Today, we're talking to Dr. Norm Oliver, the former state health commissioner at the Virginia Department of Health, about the future of population health. Let's dive right in.
Hey, Norm, how are you?
I'm doing great, Dan, and yourself? Good to see you.
Good, good. I don't know if you've met Faisal.
No, we've never met.
Nice to meet you, Dr. Oliver. I'm Faisel Syed.
Nice to meet you as well.
Thank you so much for taking time out of your life and your schedule to come join us and have a conversation with us about population health, and especially the future of population health.
Glad to do it. My schedule's a little freer these days, so that part wasn't too tough.
Yeah.
Yeah. And we should probably tell, in full disclosures, we should let the audience know that Dr. Oliver and I worked together for 20 years at UVA. And then when I left to come to ChenMed, he left to help lead the Department of Health in the state of Virginia and was the health commissioner, at least until recently, which I don't know that I ever told you the story. So one night early on in COVID, I was very worried about what was happening. And I had this very vivid dream, and I don't usually have dreams. And it was my dad who passed away about 15 years ago. And the hymn was playing in the background, Well with My Soul. And it was just it's sort of that peace that you get. I don't know where it comes from. And then I got up that morning and I turned on the TV to see the update on COVID and watch news. And Governor Northam, the governor at the time, was a physician, and you were standing right behind him. And I'm like, we're going to be okay. I'll get through this. So I don't know if you felt that way that day, but it gave me a lot of peace that day. So it made me feel really good. But anyway, you and I started our population health journey together, and I think it'll be a good discussion today.
Good, good. Looking forward to it. And yes, I I think Virginia was able to do really well in responding to COVID-19 over these last 2 years, in part because we had a physician who really followed the science as a governor. We had a physician as my immediate boss, the Secretary of State, Secretary of State, Secretary of Health and Human Resources, Secretary Kerry, and myself, and we were all pretty much aligned on what needed to be done, and it shows up in all the stats. I mean, Virginia's about 10th in the country as far as number of people vaccinated or percentage of people vaccinated, and all those who have a higher percentage have much smaller states for a state our size, and it's really quite good. And especially if you compare us to the South, we're probably tops in the South.
As a family physician, yeah, we love to hear the story of family doctors. I've read a little bit about your background, going up to Alaska and then coming back to Virginia. So I'd love to hear your story. But I trained in family medicine. Dr. Dan, of course, trained in family medicine. We're very passionate about family medicine, the future of family medicine. So we'd love to hear your story.
Yeah, so I was many years ago. I was actually a journalist writing in small media out of New York. Traveled a lot, saw a lot of things, wrote about a lot of things. Got very interested in people in general and what motivated them, how they came to do the things that they were doing that I was writing about, and got very interested in essentially history and politics and anthropology, a lot of different things like that. Um, I wound up in Cleveland editing. I was not the editor, I was a managing editor on a group of um, medical throwaways published by Harcourt Brace Jovanovich, one of which was Modern Medicine, which you've probably seen as a family doc. It's a throwaway that goes to family physicians. And I came home one day and I told my wife, Susan, I said, hon, this stuff looks really interesting. I think I'd rather do it than write about it. And she said, go for it. So I did. And I got myself into Case Western there in Cleveland, and did a MD PhD program in medicine and medical anthropology, and got my master's, got through the oral stuff on the PhD, finished the PhD courses, and never got funded for my dissertation research. And I said, you know what? One doctorate is enough. uh, Finished my residency and went up to Alaska. And we were in rural Alaska, about 400 miles northwest of Anchorage, about 400 miles west of Fairbanks, about 60 miles inland from the Bering Sea, in an Eskimo village called Bethel,
Wow.
which is on the second largest river in the state. The largest river everyone knows is the Yukon. The second largest is the Kuskokwim, and we lived on the Kuskokwim. Um, and I did full broad spectrum family medicine. It was actually pretty shocking coming from a residency program in an urban city that was, very dominated by the subspecialties, right? So I remember once calling up, and I had some woman in the ED who had a peritonsillar abscess. So I call up the ENT down in Anchorage. I said, I got a woman with peritonsillar abscess, and the weather's bad. I can't fly her down. He says, that's okay. You can do this. And he talks me through aspirating the abscess. Yeah, push it in a little bit farther. If you feel a pulse, watch out. That might be the carotid.
Oh my God.
So it was a wild ride. I got to do everything. All the stuff you train for as a family doc, I got to
Wow.
do and more. So it was a great couple of years, but I got recruited to UVA and I loved it there.
Wow, but why Alaska? Was there something that drew you there from before and you just knew you had to go out? Like, why did you pick Alaska?
In my second year of residency, I did a elective rotation um, out at the Pine Ridge Sioux Reservation in South Dakota, and worked with an obstetrician there. And we saw the women in the clinic, and I was with them in the OR. This was over a period of about 2 months that summer. And fell in love with that big sky sort of out there in the Dakotas. My family came out and joined me on the reservation for a couple weeks. We traveled around, looked at the Black Hills and the Badlands, and of course we went to Wall Drug too. So everyone should should know that. Full disclosure. And then we drove over into Montana and went out to um, Wyoming and Yellowstone. And then, so we all just sort of fell in love with big sky country, and uh, it's pretty similar up in Alaska. It's the last wilderness. So that was one attraction. And then, like I told you, I studied anthropology, and not if I figured if I was going to be that far away from home, it should be in a culturally totally different kind of environment, which it was. So culturally, I learned a lot. Clinically, it was really astounding what I was able to learn, um, and I was a part of a loan repayment program, so I knocked off a bunch of my med school loans as well. So it worked out well.
Wow. That is wonderful. And then you got recruited to Virginia.
Yes, got recruited to Virginia. Now, initially, I had wanted to be a researcher, and the 2 years up in Alaska it was I was busier than I was when I was a resident.
It sounds like it was very hands-on.
Yeah, it was incredible, and for at least a year and a half of that, I ran the ED, um, which I mean, we had about 6 rooms, but we were busy. We had about 19,000 visits a year, which is saying something because where we were. Bethel is the regional capital of an area that's the delta washout from the Yukon and Kuskokwim rivers. It's about the size of the state of Oregon, this region, and but there's only about 50,000 people across the whole place, right? So, so you can imagine. what they must be doing in order to build up 19,000 visits.
Goodness.
I tell everyone that for the adults, the number one um, problem in that part of the country, at least back then, was alcoholism and
Really?
yeah, binge drinking. I mean, and you get these people who would smash their snow machine into a spruce tree, which is hard to do in the tundra. It's like, how did you find that one tree? You know, but which you could only do when loaded up on vodka. But anyway, um, so I had always wanted to be a researcher, and I got down to UVA, and I spent the first, Dan can tell you, the first part of my career there doing research on health inequities in um, African American Latino communities, primarily in cancer health. And over the years became pretty successful as a researcher. But towards the end of my stay there, I became chair of the Department of Family Medicine at UVA. And Dan alluded to the fact that we had done a bunch of work around population health there. Dan was the medical director of the Accountable Care Organization that got established there. And I was involved also in the medical leadership of that ACO, looking particularly at issues around population health. So that's sort of my journey as a family doc.